So for my presentation today, I really wanted to focus on navigating the intersections of being LGBTQ plus, living with Parkinson's disease, and how we can really advocate for ourselves as well as others within the health and aging system. So that's going to be the focus of what I share with you today. For those of you that may not be familiar with SAGE, SAGE is the country's largest and oldest organization dedicated to improving the lives of LGBTQ plus older adults. And our mission is really to lead in addressing issues related to lesbian, gay, bisexual, and transgender aging. Um, and yes, we have a roll of thunder. So gonna give some dog treats here. There we go. We also have to multitask when we work remotely. So that's what I'll be doing today. SAGE is headquartered in New York City and offers a number of services throughout New York, including the lead agency for the National Resource Center on LGBTQ plus aging, SAGE Cares training and credentialing program, and the first ever LGBTQ plus senior centers. We have 5 senior centers across the boroughs of New York City. So that's really important work that we're doing in New York City. As we really start to think about our LGBTQ plus older adult community members, back in 2015, they estimated approximately 3 million. As Jason referred, I think we're now closer to between 4 and 5 million LGBTQ plus older adults. And by 2030, we expect this population to grow to nearly 7 million. And, one of the things that people will sometimes ask is, well, why is the population growing this fast? Well, we know that baby boomers are a growing population. And we also know that more and more LGBTQ plus older adults are becoming more comfortable to be out and to share about, our lives as LGBTQ plus people. So as more and more people come out and identify as gay, lesbian, bisexual, transgender, queer, those numbers are going to continue to grow as well. So why focus on LGBTQ plus communities? And this is a quote from one of our fact sheets, and I think it really does a good job of really centering the conversation today. Going to the doctor or seeking medical care for even minor issues presents unique challenges for LGBTQ plus people. The decision to come out to your provider, concerns about interactions and reactions from providers, this can really hinder the health care that we receive, as well as our ability to be open and honest with our providers. So, that's one of the reasons why it's really important for us to think about the intersections of being LGBTQ plus, as well as, receiving supportive services in healthcare and aging services. The Parkinson's Association has estimated that there's nearly 100,000 LGBTQ plus folks living with Parkinson's. And sometimes folks will look at these types of numbers and statistics and say, well, is that really a critical need? And one of the things that I like to do is ask people to visualize what 100,000 people looks like. So if everybody today went to Michigan State University for a football game and you looked around that stadium and you realized that every single person sitting in that stadium was LGBTQ plus and also living with Parkinson's, that would help to explain why this is critical. And when we start to think of numbers as people, that's what really starts to frame the importance of this work. Because we see that, that would be a large gathering of folks who share commonalities, who share same concerns, and is really the focus of why we're here today. So I hope that kind of helps frame, why it's important to think about LGBTQ plus folks living with Parkinson's. We also know that there are some common concerns for LGBTQ plus communities. And some of those things include the fact that 34% of LGBTQ plus people live alone. 32% don't want to be alone and are actually concerned about their aging process and living alone. We also know that an additional 40% have shrinking support networks, and they oftentimes will seek to, the internet for companionship and finding support. So, why are these concerns for us? Part of the concerns, are the fact that LGBTQ plus older adults living alone oftentimes don't have the same access to supports that other older adults may have. And so it's really important that we think about the support structures, especially in programs that are offered through groups like the Parkinson's Association. How are people being supported if they're already at risk for higher social isolation and loneliness as they age? So those are some of the common LGBTQ plus concerns that we see. We also want to think about the lived experiences of our LGBTQ plus older adults. LGBTQ plus people have had a history of discrimination, and this discrimination has oftentimes taken place in healthcare settings, in aging settings. So if you've experienced a history of discrimination and stigma at the hands of folks that we're really asking now to show us support, concern, compassion, and quality care, it can really interfere with our comfort level in seeking those supportive services. So that's one of the reasons why it's so important to center LGBTQ plus services in these settings. We also know that there's a reliance on families of choice and oftentimes same age peers. Why would this be a concern? One of the reasons for this being a concern is that when we think about caregiving, it's oftentimes provided by children. And we know that LGBTQ plus older adults oftentimes are less likely to have children, as well as being more likely to live alone. So that reliance on families of choice is oftentimes being supported by the broader community, by people that we've invited into our lives, and they're oftentimes not recognized legally to be the folks providing that level of support for us. So that becomes a concern if LGBTQ plus older adults haven't done the planning to ensure that they have durable powers of attorney, that have been named, that they have folks that can serve as their healthcare proxies. And so it's really important that folks are taking the time to, develop the plans and really have things in place to support them as they age. The other issue around same age peers. I want to take a few minutes and just talk about this because I think it's oftentimes not recognized how critical same age peers can be to one another, in those support structures, but also how fragile a support system becomes if it's made up of all same age peers. Through my work here with SAGE and in St. Louis in particular, gonna let the pups leave real quick. Sorry about that. Um, in our work in particular here in St. Louis, I befriended 4 women, and they were best friends. They had known each other for going on 50 years, and they did everything together. They went to lunches together. They drove each other to doctor's appointments. They helped each other out, around their house, no matter what. If somebody needed a ride to the grocery store, they stepped in. We lost one of the women right as we went into COVID. And so that, and the 4 women, it was 2 couples. And so one of the partners died right as we went into COVID. So that left another one of the women, living alone and isolated. Then we saw the other couple experience their own health concerns. One had a heart attack, another had a stroke, and one was also developing dementia. So this left a very fragile support system. They went from 4 women supporting one another to 3 women supporting one another. And then over the last year, one of the couples, both of the folks in that couple passed away. So here we have one woman left, and she's really lost her entire support network that she had relied on for 50 plus years. So when we think about these same age peers and these support structures, we start to see just how critical, you know, developing a bigger support system can be. And so when we think about folks aging with Parkinson's disease, thinking about who is there to support folks, who is there to help when they need that level of care and support that may come, as we age. Those are really things that we want to think about, and also to think about how we can support the families of choice. Have they developed the care plans that make sure that, people can make decisions on their behalf and with them should that time come? And we'll be giving some resources later in this presentation to help with that. Some of the other things that we also see, because of the history of discrimination, we can see that the lack of access to LGBTQ plus welcoming health services. And, the Human Rights Campaign Foundation Long-Term Care or Healthcare Equality Index is one of the programs that has really helped to support greater access to LGBT welcoming healthcare services. And, that's always a resource that we help people locate and find supportive services in their communities. The history of discrimination and stigma has oftentimes also led to a delay in seeking supportive services. So if folks fear discrimination and they've had real experiences with stigma and discrimination within healthcare systems, they oftentimes won't seek supportive services. They won't go for preventative healthcare screenings. They may, learn later in life that they have Parkinson's or some other health concern. And this can, that delay in healthcare leads to that delay in the preventative programs that helps them remain healthier as they age. So it really becomes a concern for our older adult community if we've not been seeking those supportive services that are available. And what we've oftentimes found as far as aging services, that if a person has delayed services and delayed seeking the supportive services that are available, such as nutrition programs, transportation assistance, home care programs and services through your area agencies on aging, that oftentimes the services are not sought until it's too late. And so we've seen people have to immediately leave their homes and go into a long-term care setting because those supportive services haven't been provided early enough to help them remain at home where they can age in place. We also see an increased risk of health disparities and disability. If we've delayed services, we've delayed preventative care, then we're going to see an increase in health disparities, which can also lead to disabilities as we age. So again, it's important that we start to create these systems that are welcoming and supportive of LGBTQ plus older adults. And then finally, this increased reliance on paid long-term care services. There's a couple of reasons here. One, lacking support systems. If we don't have children, if we don't have extended family who's providing support, and it's reliance on families of choice and same age peers, then we may need to turn to more paid services, including skilled nursing and assisted living, in order for us to age with a sense of health and equity. So we see that there's this heavy reliance on some of the long-term care services and supports. Aging at the intersections. I think it's always important that we really think about, what that means for us. And one of the quotes that really speaks to me is from Kimberly Crenshaw. And she states that intersectionality is a lens through which we can see where power comes and collides, where it interlocks and intersects. It's not simply that there's a race problem here, a gender problem here, and an a class or LGBTQ problem there. Many times that framework erases what happens to people who are subject to all of these things. So when we're here today, we're really thinking about the intersections of every person that we serve and knowing that they may have multiple um, characteristics and intersecting identities that can lead to even greater challenges, especially when it comes to, interacting with healthcare systems and other aging systems. So it's really important that we see people for their whole selves and how all of these intersecting identities can impact their health and well-being, and especially that sense of equity. So this is one of the things that I always like to reflect on in my work. And I hope that more of us will start to do this as we are thinking about the services and supports that we provide. So I want to spend a few minutes now talking about some of the resources that we have available through the National Resource Center on LGBTQ plus aging, as well as some of the other programs that I work with here at SAGE. We've prepared a document that's really designed for self-advocacy for LGBTQ plus older adults. LGBT communities are resilient, and we have a history of creating change through large and small efforts. And advocacy is an important tool LGBTQ plus people have in securing and managing quality health care. One of the models that I really like to think about in terms of self-advocacy are people aging and living with disabilities. And self-advocacy has always been kind of a center focus for folks living with disabilities. And so how do we take that and apply those same types of models for LGBTQ plus older adults? And that's really, embracing self-advocacy. So providing tools and resources that help LGBTQ plus older adults, prepare for their own interactions within health and aging systems is one of those ways to help them be better prepared. In this document, it's a real easy fact sheet to use and look through, but there's four main things that we think about. The first is preparation. When we're thinking about interacting with healthcare systems as an LGBTQ plus older adult, how are we prepared? Sit down, write out all the questions that you may have for your doctor, for your healthcare providers, for your specialists. Because as we age and we may have a number of health concerns, the number of doctors that we may end up going to can be overwhelming. And so it's really important that we prepare for each one of those healthcare encounters. Also prepare by thinking if there's one of your family of choice members or your spouse, partner, somebody who can go with you and also help advocate with you in that healthcare setting. Another area that we like to think about is communication. How are we communicating our needs to our healthcare providers? Are they aware of what we need, of what our concerns are? It's really important that we think about how we're communicating and also how we're encountering people in their office. When we can find supportive, nurses and other folks in that medical professionals space, then that can help us as well with our communication. Another area is cultivation. And again, this is really speaking to a lot of the other folks that we may be encountering, not just the doctor, but nurses, the clerk, who's checking us in when we go in for a doctor's appointment. Cultivating positive relationships with all the people that we're encountering can help us to have better access to our doctors and our specialists. And then finally, the other thing that we talk about is documentation, making sure that you have access to your medical records. If if you have a question about what your doctor has been sharing with you, go back to them and ask them for a report on, on your latest checkup, on your latest medical procedure that you've had, and make sure that you have all those resources available for you as you encounter the healthcare system. So this is just one of the documents that we've prepared, and it's available for download and to share with others, that you may be working with. Another important piece that we've developed and is another tool for self-advocacy is a guide on care planning. And I can't stress this one enough because I think our own self advocacy starts with planning for our care. And too often we don't think about planning for our care until we're in a crisis. So taking the time, to do pre-planning is really important. And this guide helps take us through a number of different areas that I think can really help us, regardless of where we may be in the encountering healthcare systems. Some of the things that it goes through is helping us to look at what to expect before and after medical procedures. It could be regular routines that we're going in for, or maybe it's a surgery or, another critical aspect of our care that we really need to think about. It also helps you think about the questions that you want to ask your doctor. Looking for and choosing LGBTQ plus affirming providers. It gives you a number of tips and resources to think about because it's really hard, to navigate these healthcare systems and know, is this a doctor that I am going to feel comfortable with? Um, and one of the best ways to do that is to seek out guidance from the LGBTQ plus community who may also be engaging, with healthcare providers. There's a couple of listservs that I belong to and some Facebook groups. And I would say it's probably almost a daily occurrence that you will see somebody, chime in and say, I'm looking for a new, healthcare provider. Can anybody recommend somebody that's LGBTQ plus friendly? So it's really important to think about, where are we going for care and who is providing supportive services. But it's also important to recognize that not everybody has choice, depending on, the availability of healthcare systems in your community. There's not always choice for encountering somebody who's openly identified as LGBTQ plus welcoming. So some of the tips and tools in this guide can help you kind of navigate that system as well. One of the things we also stress in this guide is asking for help. I think that's one of the most challenging things that really most everybody deals with is how do we ask for help? And how do we become more comfortable feeling like it's okay to ask for help? And so this guide helps prepare us for that. And I think part of that is also thinking about the types of help that we may need. So it's easier if we can develop a list that says, I'm going to be going in for a procedure, or I know that, I'm going to be home for a while recovering from, a healthcare um, crisis or encounter. And these are the types of things that I may need help with. I need somebody that can go to the grocery store for me or pick up my medications, walk my dog or my two dogs, as may be the case for me. Um, those are things that can be really beneficial for someone, but it's oftentimes hard to ask for that help. So this guide helps us to start to think about what types of help do we need and how do we ask for that help. I think it's also important for folks, oftentimes people want to offer help, but they don't know what to offer. And so just to start to have these conversations with the folks in our circles and our communities can be really empowering as we think about, I can go to the grocery store for you. I can walk your dog. Let me be there. Let me help. So this guide helps folks to really think about that. And then finally at the end, we talk through issues around advanced care directives, hospital visitation rights, and other things that oftentimes people put off. Um, and it's really important that people know you have the right to name the folks that you want supporting you. You have the right to name the folks that you want being able to gain access, to your medical information and also for visitations in hospitals. So it's going through programs and resources like this that can really be beneficial. And again, this is available for download on the Resource Center website. When we think about encountering our healthcare systems and other aging services, there's a couple of resources that are also really important for advocacy on behalf of LGBTQ plus communities. So if you're a provider or a professional in the room today, I encourage you to look at these resources. The first is Inclusive Services for LGBT Older Adults, and this is a practical guide to creating welcoming agencies. It really helps you to evaluate, are we a supportive service? What does that mean to be a supportive and welcoming agency? Have we taken the time to evaluate our own internal policies and procedures and make sure that they're fully supportive of LGBTQ plus older adults? So I encourage you to look through this. There's best practices that we have available, and it can really help organizations start to think about how they need to do a better job of centering supports and services and policies and procedures for LGBTQ plus older adults. The next guide that we have is Inclusive Questions for Older Adults, a practical guide to collecting data on sexual orientation and gender identity. As Dr. Flatt mentioned in the beginning of the presentation today, we don't know a great deal about the experiences of LGBTQ plus older adults, LGBTQ plus communities in general, in many of the things that we talk about in aging and health services. And that's because there's been a lack of data. And so it's important that we start to collect information on sexual orientation and gender identity. A lot of people will say, well, these are private questions. These are things that people aren't comfortable talking about. The reality is, we talk about sexual orientation and gender identity every single day. We just haven't claimed it. If you talk about, if you're a cisgender heterosexual person and you talk about what you did with your husband or your boyfriend or girlfriend over the weekend, you're talking about your sexual orientation. So when we start to frame these conversations as really everyday conversations that we all have on a daily basis, then it starts to break down some of the stigma around asking these questions. And so this guide helps you to think about, here's the questions that we should be asking, and here's how we can ask those questions. And again, it comes with a number of best practices that can help as you start to center this work in your communities. And I'm really excited about this next guide that was actually developed, with the Parkinson's Association and with SAGE. And this is Supporting LGBTQ plus people with Parkinson's, a guide for LGBTQ plus community centers and health centers. One of the key parts for self-advocacy is also encouraging groups working within the LGBTQ plus community to have a greater understanding of the things that impact our community. And Parkinson's is one of the issues that I'm sure has not received a lot of attention within the LGBTQ plus community. So this guide will help to bring those resources to light. And by focusing on our community centers, we have over 300 LGBTQ plus community centers across the country. We have a number of federally qualified health centers that do specific LGBTQ plus outreach. By getting information into their hands, then they can better help prepare their patients for understanding and their clients for understanding some of the concerns that are related to Parkinson's disease as an LGBTQ plus person. What's included in this guide includes 10 early signs of Parkinson's, a basic understanding of Parkinson's, key questions to ask your doctors, 5 steps to live better every day with Parkinson's, and a guide for support group leaders. So I'm really excited for us to start pushing this resource out to our communities so that the LGBTQ plus community can get more actively engaged with support of our own community members. And then we also have some resources that are really designed for LGBTQ plus older adults that I wanted to highlight today. One is our National LGBTQ plus hotline. This hotline is available 24/7, 365 days out of the week. It's in partnership with United Way Worldwide, and it's really a support line and kind of a crisis line. The nice thing about this hotline is because it's in partnership with United Way, they can actually get people connected to their local community and to the providers in their community that they may need. We have found, through the work with the hotline that 53% of our folks that are calling in are experiencing some level of social isolation. And so this hotline can really be a critical support system for folks who are feeling isolated and alone in their homes and communities. Another resource is our program called Sage Connect. And this is a friendly call line where people can be matched with a volunteer who will reach out to them and call them on a weekly basis to check in and provide friendship and support. And again, can help connect them also to needed resources in the community. So these are two programs that we just wanted to make sure that folks are aware of on the call today. And then a couple of other resources. One is our Long-Term Care Equality Index. This is a program designed to work with retirement communities, assisted living, skilled nursing, to make sure that folks have access to quality care and supportive services as they age. Through this program, the long-term care communities actually take a self-assessment, and they are then provided with a report that helps them identify, the areas that they need to improve upon to truly be LGBTQ plus inclusive. They then have an opportunity to implement policies and procedures that really support LGBTQ plus inclusivity, and will then have the opportunity to take a survey where they will be able to demonstrate back to our community that they have all of these best practices in place to better support LGBTQ plus older adults. As we said earlier, there is a heavy reliance on paid long-term care services and support. So a program like this is really critical for LGBTQ plus older adults. This guide one of the guides that we have available through the Long-Term Care Equality Index is finding an inclusive long-term care community. From a place of self-advocacy, we know that, there's still limited long-term care providers across the country who are outwardly promoting LGBTQ plus inclusivity. And so this guide helps older adults and their caregivers really start to evaluate, is this a place that has policies and procedures in place? Is this an organization where I'm going to feel welcomed and supported? And if not, it's also a guide that you can hand to that community and say, we'd really like for you to become LGBTQ plus inclusive. And here's some steps to help you along the way. So again, this is a part of self-advocacy that we encourage LGBTQ plus older adults to think about. And then for professionals in the room, we have our Sage Care training and credentialing program. This is a fee-for-service program available through Sage, and it provides organizations with the opportunity to invest in LGBTQ plus cultural competency. For folks that complete the training, they can also then qualify for our credential, which helps you to, again, have that outward signal to the community that you're not only LGBTQ plus inclusive, but you've also invested in, LGBTQ plus inclusivity for your community. So these are just a couple of other resources that we wanted to leave you with today. And I think that puts me right at my time for this presentation. I just wanted to end by, sharing my contact information and 3 of the websites that we've talked about today, where you can go and find additional information on Sage, as well as the self-advocacy tools and resources.